Welcome, and we are here at Kyabirwa Surgical Center with the amazing Anna. Anna, welcome.
Thank you. Thank you so much.
Thanks for hosting us and for hosting the very first stent insertion workshop in Uganda.
It's a pleasure. We're privileged to have the opportunity to host you.
Absolutely. Maybe before we start, could you tell us about yourself and what you do here, and then we can kick it off from there.
Okay. So my name is Anna Kalumuna, and I am the Executive Director for Global Surgical Initiatives, Kyabirwa Surgical Center. And I have been the pioneer employee for this organization, having started out in 2019 by the Mount Sinai Health Surgical Department that decided to come to a remote area and do what they do best, which is provide surgical care to the most vulnerable patients. So when I started out here, the mandate was how can we reach out to vulnerable communities with affordable surgeries in an excellent way in a remote area, but offering what we would offer in an urban area. And so that's how Kyabirwa Surgical Center came into play. And I had the privilege to start the project and find the team to work with, set up the system, and get it to what it is today. It's been 5 years now.
It is an incredible place, but perhaps before we even get into why we're here today, could you take us through some of, maybe share some of the needs in this community? What have you seen over the years in terms of surgical needs, especially, maybe I'll just say surgical needs.
Yes.
Yeah.
So just like the statistics have shown, over 5 billion people, that's the number we work with worldwide, that have no access to surgical care. This community comes with a very grave gap in the same. And Eastern Uganda is one of the areas with very limited health care in terms of quality and resource availability. And so it was the right area to set up this entity. And with the catchment area covering the whole of Eastern Uganda, we're looking at more than 5 million people who are able to access this center. In terms of surgery, every 10 patients that go for health care, about 4 or 5 of them might end up with a surgical need. And so because of that, the center is strategically placed to receive the ones that can't afford the upscale surgical care, but with a promise to provide what they would get exactly elsewhere. So so we have a whole catchment area of many districts and within the Eastern Uganda. And we even get patients from other parts of the country, from Western, from Northern Uganda, and they come here for surgery, they come here for endoscopy or interventional care, and so the gap is glaring.
Yeah, I mean, I was just a quick follow-up to what you just said. In terms of the surgical needs, again, that patients come for to receive here, what are some of the predominant ones?
Yeah, well, the most obvious is hernia. Actually, this region has even a name for one particular kind of hernia that they call the Busoga hernia, because it's prevalent in many men within the region. So hernia really takes the kick. But lately, we're getting several other conditions, and one of them, interestingly, is the patients that present with end-stage esophageal cancer that come here for interventional care. They come here for stenting. They come here to manage their obstruction, the dysphagia. So we get all sorts of conditions we have, but top on the list is hernias. We have appendicitis. We have things like the gallstones. We get there are a whole lot of surgical conditions that are prevalent in the area. We get a lot of malformations for the children that need to be corrected. and to mention but a few, but a whole assortment of them. Yeah.
Well, it's a great segue. You mentioned esophageal cancer, and we're here today specifically for that. Take us through the trends of esophageal cancer patients here, and then we'll take it from there.
Yeah. So when we started out, after we brought endoscopy equipment, that was a year after we began, we then started getting patients that presented with end-stage cancer of the esophagus. And it became an area of intrigue because at first we would see like 1 in every 10, but before we knew it, that number was growing, I guess because people got to know that the center had brought endoscopy equipment and we were able to offer interventional care. And so, with the training by, the team, the specialist doctors from the US, we were able to get our team to master the intervention stenting, and the more people heard about that, the more we started seeing more patients, and we became curious. Why is cancer of the esophagus becoming prevalent, very dominant in this area? And it's therefore interesting that when AFREC and one of the members of AFREC, Dr. Jerry Way, who is also our partner and our philanthropy, who offers mentorship and training, was very gracious enough to introduce us to the AFREC community. And his interest was to support us in strategic partnerships that can enable both training, mentorship, and even negotiate for us a good, reliable supply for the stents, because the biggest challenge for these patients who present with end stage is they need to be stented, to insert stents within for them to be able to feed again. And those stents are very expensive.
They are.
On the Ugandan market, the least you can get it at is 1 million Ugandan shillings, just the stent. And the patients we see here are way below the poverty line in terms of economics. So it's the partnership through AFREC has introduced us to some entities that are able to link us to a good supply affordably. But more importantly, starting today with this week, we are having doctors from all over Uganda, from the different regions in Uganda, coming here, converging here, and being trained by AFREC on stent insertion. The advantage with that is now the skills that started off here are going to spread to other parts of the country, and the training is coming from the experts, from the seniors in this field. So it's exciting for me to see that we've been able to gather more than almost 50 patients who are going to spend a week with us getting stents inserted and giving them a chance at a decent palliative care.
Right, and what you mentioned, some of the backstory that we've given is really important for our community to understand that the need is huge, the costs are high, and that intervention is necessary where costs are minimized. And as Ugandan diaspora and as a board member of AFREC, it gives me so much gratitude to see the impact, of the potential impact of capacity being built beyond one center. And it's heartwarming to see the clinicians from other parts of the world. But maybe the question to you is, how do you envision a partnership with other hospitals and healthcare facilities across the country going forward? Because that, we've talked independently about the need for partnerships.
Yeah, that's a very good question. And I must also note that our vision bearer, the founders, one of the things that they acknowledged is, if we're going to deal with a surgical gap or with a healthcare gap, we cannot afford to be isolated. So whatever ideas they come up with, our first question is, how do we replicate this in other parts of Uganda? Because like I mentioned earlier, we get patients coming from northern Uganda, coming from eastern Uganda. These are patients traveling over 500 kilometers to get to this center. So the question is, how do we make sure that we don't keep the service here with us? And for starters, when we began, how we began the whole endoscopy unit was we got our founder, Dr. Marin, interested one of the senior endoscopists in the US, Dr. Wei, who came here and just spent a week interacting with us. In that week, he trained surgeons from our center and doctors, but we also invited surgeons from other parts of the country. We got some from Jinja Regional Referral Hospital, from Eastern hospitals, and were able to train about 8 surgeons along with ours. And the intention was, if they pick the skill, prolonged mentorship can give them, proficiency. And so after a week, when he was gone, we opened up remote collaborations where he sits into the procedures remotely and is able to mentor our doctors to get better. And that's what we in research happening even now. The doctors that we have collected all over the country are going to go back to their centers and will have a collaboration with us, everlasting, whose role is really to help them get fluent at the procedure, at the stent insertion, and to know that they have somebody supporting them, just like we've been supported. So it's a sort of paid forward kind of thing, where we are being supported, we are supporting, we're hoping they support, because that's the only way we can deal with the gap. Otherwise, sticking to just this center would be so unwise, obviously.
Absolutely, and not to put you on the spot or in a compromising situation, how do you envision partnership with the Ministry of Health?
Yeah, that's a very good question, because of course the Ministry of Health is our main regulator, and them we are happy that they are aware of our functioning here. But more importantly, they facilitate and make it easy for us to roll out the programs that we roll out, because of course we can't do this without authorization. We can't allow, even the doctors that come to train, even the equipment that we have to bring in has to be authorized and checked out through the Ministry of Health and the related arms like the National Drug Authority. So for us, our interest would be for the ministry to get more involved in our programs, in terms of which departments can we liaise with as we train more doctors, as we bring more equipment, so that whatever resources are being delivered here can be leveraged out for the other facilities that the Ministry of Health is working with. And like I was telling you earlier, a very interesting equipment just fell into our hands recently. It is called the IntelliBlade. It is an equipment that uses sonographic technology to go into the abdomen and locate liver masses and be able to blast them or dissolve them. It's the first of its kind in Africa. And it was, of course, a donation. And so when it lands in here, and it has potential to handle several patients. We cannot keep it to ourselves as Kyabirwa. Our role is to go to the ministry and tell them, we have this amazing facility. How can other hospitals leverage with us? And that's what we're doing. We go to the different hospitals, interest them in our programs, and make sure they work with us to benefit.
Absolutely. That's, again, another fantastic opportunity if you're watching out there and you're part of another hospital system to partner with Kyabirwa. But you mentioned, just even starting with that one, that equipment, how many departments does Kyabirwa have?
Right now we are running 9 departments.
Okay.
Everybody else falls in that structure. Both the ones that are non-clinical as well as the support, the clinical and the non-clinical. The non-clinical are the support departments, which is really administrative.
Okay.
And the others, the clinical, we're looking at the surgery department. We are looking at anesthesia. We are looking at a laboratory. We are looking at diagnostics, where we have the radiology. And we have a simulation center. We have a center that is training doctors in the skills that I've been talking about, laparoscopic surgical skills, endoscopy skills. That's another hub that we are excited to share with the rest of the world. So the other departments are really more of administrative, that, you know, things like the biomedic department. So it's a whole altogether, it's 9 departments that are comfortably running the facility.
Yeah, I mean, one of the impressive parts of this facility is the solar panels. Could you say something about that and how what role they play in this whole surgical thing?
So when the vision is driven by trying our best to be sustainable. We try to emphasize that it shouldn't be a hit and run. It should be a system that will be able to run long after Anna is gone and the chairman is gone and everybody is gone. That said, we are aware of the dynamics of operating in a rural area like this one. You certain utilities will always be, infrastructures will always be a gap. And so right from the start, we knew that for reliable power supply, solar should be the solution, because with Uganda has sunshine day in, day out, and so we can afford to store it in our batteries and have a reliable system. So for us, that was the motive, not just for solar, for water as well. We have a storage capacity of over 150,000 liters of water underground. We have also started putting up a project of a well that can also feed into those tanks, because we get a lot of rain here. There's no reason why we can't harvest it and store it and have water in and out of season. So we try to think through how we can make sure the center runs sustainably, not dependent on any other sort of supply chain.
Right.
Yeah.
And then I guess one of the final questions, I know you're a busy lady, I wanted to ask you so many, but the most important one, in what ways can organizations like AFREC and others out there, in the United States or any other part of the world, support this center?
Yes, that's a very good one, Vivian. I it's like throwing a child in a candy shop and asking what you want to pick. That's how it feels like. Because of course, like I said, the overall driving factor is reach everybody who needs surgical intervention and reach them offer them a service that's excellent, that is safe, that is affordable. Somebody somewhere at the back is meeting the cost of this care. And so we like it when organizations come forward and offer us partnerships. I'll give an example of Olympus that has agreed to supply certain equipment as grants. Our training equipment in the training center has been donated by organizations like Olympus, like Boston Scientific. We like that Uganda Cancer Institute, for example, is now aware of us and is working with us to see how can they support the rural patients to have smooth holistic care by partnering with us. So we start off the primary health care and be able to complete the cycle with them. We have other organizations like AmeriCares in the United States as well that work with Johnson & Johnson and other entities to put together certain facilities, especially those that are not readily available in the Ugandan market. So for us,
and you forgot AFREC.
Oh, and AFREC's role has really been pivotal in connecting us to the right entities. For example, connecting us to Boston Scientific, connecting us to the entities that are able to support with affordable equipment, but also training, because you might have all these equipment and facilities, but you have the skills. And for us, that really is top of the agenda, because once we get the skills and then we rally other people to join us, then we are able to meet the vision. Yeah.
Well, Anna, is there anything we haven't talked about that you would like to say before we say goodbye to our viewers?
Well, there's a whole feeling that rural areas don't have anything good to offer. We want to break the stereotype, and we are excited to do this with the backup and the support of organizations like AFREC, of organizations like Olympus, Johnson & Johnson, AmeriCares, etc., Boston Scientific, Uganda Cancer Institute. There's so many entities that have finally caught the vision and the fire that we want to be caught out there. And we believe if we have that synergy, we are going to be able to make a difference, a remarkable difference. Of course, the gap is big, the demand is big, but every little service that we offer that chips away a health challenge is able to bring smiles to the community. So we're excited that AFREC honored us by giving us this workshop this year. I hope they will be back next year, because I think it's a game changer to be able to do what we're doing this week.
Thank you. Thank you for mentioning that. Selfishly, yes, I'm right. Just saying, yeah. Anyway, but also I think I wanted to point out, as we say bye, is that it's part of one of the critical players we have is government of Uganda, and I think it's a good time to say thank you to the embassy who are building these partnerships with American organizations like AFREC. It's through that partnership that we can expand some of the work that is, it can be a bridge between the companies and organizations that need an entry point into Uganda to continue scaling these programs across the country. So to the government of Uganda, especially the Uganda Embassy in Washington, D.C., thank you very much to Ambassador Rebecca Konge for the leadership and partnership. With that, I just wanted to say again, Anna, thank you so much for the work that you do. Yeah, at Kyabirwa, it's phenomenal, and you've got so many good reviews from those who have worked with you. So thank you, and those reviews are real.
Thank you so much. Thank you for taking your time to be here with us, and we're excited.
All right, I look forward to talking more.
Sure.
All right, and to our viewers, thanks for watching. Till next time.